Good morning, good afternoon, and good evening, everybody. Welcome to the session on health and safety. I'm very happy to be here and I appreciate your time and effort to listen to us. Today, we're going to talk about, I think, a very timely and interesting topic in terms of ADB project implementation and global issues as well. The theme of the seminars overall are results, resilience, and recovery. In a sense, I think the health sector plays a very strong part in all three. But I think also we can think about the two objectives of this meeting, of this seminar, which is basically two sort of almost distinct objectives. First, we would like to describe to you or present to you recommendations and views on how health sector outcomes can be achieved through ADB projects in many ways, in different ways, and not just only through pure health projects. The second outcome or the second point of this project is how to strengthen and ensure very good occupational health and safety in ADB project implementation. And of course, this is relevant to all other development projects as well. Please allow me to introduce our panel of distinguished ADB experts and participants. First, let me mention that Dr. Dutta is a health economist who has worked extensively on the health sector reform, particularly with a lot of experience in US aid-funded projects in the Philippines and in other countries. He has experience in primary healthcare, human resources for health, and also a very strong focus on infectious diseases. He's worked at US aid implementing organizations, the World Bank, the RAND Corporation, US aid. He has a PhD in policy analysis related to HIV, pandemic influenza. He has a BA in politics, philosophy, and economics from Oxford University and a BA in economics from University of Delhi. Another speaker of ours is Dr. Shotaro Sasaki. Dr. Shotaro Sasaki is a senior environmental specialist in ADB. After working for a Japanese power company as an engineer, Dr. Sasaki was working in maintenance of coal and geothermal power plants, promotion of waste to power projects, and construction of power plants. He joined ADB in 2005 and worked in many areas in ADB, including Afghanistan, South Asia, India, and East Asia, including in the private sector department. Dr. Sasaki holds a PhD on international relations, environment, and policy, and MA in urban environmental policy from the Fletcher School, Tufts University, and from Sophia University in Japan. Our next panel is Mr. Stefan Rao, Senior Urban Development Specialist. Mr. Rao has worked on strategic urbanization policy and integrated economic and urban development projects in ADB, promoting socially inclusive, environmentally sound, livable cities. He supports city cluster coordination, urban-rural integration, and climate change adaptation for sponge cities and nature-based solutions, as well as circular economy and zero-waste cities, focusing on the People's Republic of China. He also has piloted healthy AG action and management planning to bring out benefits for the four-generation urban society currently happening in the People's Republic of China. Prior to ADB, Stefan worked as a consultant on sustainable urban planning and design in large projects in Europe, North America, and Asia. He has taught at universities, published papers on urban development, and has studied in Stuttgart in Germany, Bonn in Germany, and Chicago. And he has an undergraduate in mathematics and a master's in urban planning. So everyone, these are our panelists for today. They are very experienced, they're ADB experts. First of all, I would like to call Mr. Aaron Dutta, who is our Senior Health Specialist in our Sustainable Development and Climate Change Department. Please go ahead, Aaron. Thank you.
Many thanks, Najib, and good morning and good afternoon, wherever our colleagues are. So it's my pleasure today to talk about an opening topic, which is how does COVID-19 affect project implications and implementation in this pandemic period. My apologies for staying off camera as I have been unwell. That is, I guess, in itself a demonstration of how health can affect operations. So to start us off, let me split my comments in two parts, and I'll be talking about the short term, and then I'll be talking a little bit about the medium term, so maybe from now till 2 years from the current date. In terms of where I come from to this topic, where I have been involved with an ADB is on COVID-19 related technical assistance and the launch and ongoing implementation of our APVAX, which is the Asia Pacific Vaccine Access Facility projects. And my colleagues on this panel will be better placed to discuss on-the-ground practical implementation issues related to COVID-19 later. So as I start, I think to set the stage for COVID-19, as all of us have been facing in our region, we are seeing a shift in the disease and its effects on project implementation from an emergency phase to what is now an emerging and less clear endemic phase. And what this will mean is of course, fairly complicated from a technical standpoint, as it is happening alongside high vaccination coverage, the emergence and continued evolution of variants of concern. But it could be summarized in a simpler way by saying that as societies, we will have to learn to cope with COVID-19 and its virus agent SARS-CoV-2 the way that we have learned to cope with seasonal influenza. So some level of risk is going to be present, and how we manage and incorporate that risk within our projects is, I think, a topic that we are discussing today and will continue to discuss. So in the short term, there will be different interventions that continue in our DMCs and within the smaller context of our projects that are managing risk to health security. And let me talk about two different aspects. First, how COVID-19 will affect procurement in the short term. There are 3 points that I would like to make. The first is a difference to costs of inputs. And I think as many of you are project managers, you have noticed that there is a difference to the costs you're paying. There is a short-term effect to supply chains and the supply chain complications that have origins in pandemic-derived production problems. So these complications are causing both shortages and delays, and hence a difference in vendor pricing. We expect that this will continue for some time, and PPFD, of course, is well placed to map and understand these costs. The second point is that we will probably continue to see pressure from guidance from country governments as well as internally that procurement should be from vendors who have a fairly good plan to address health security concerns. During the emergency phase of the pandemic, which we have just exited or are still exiting in some countries, this involved talking to and working with vendors who had a good prevention plan on their sites and where their employees wore masks or were otherwise taking precautions that were necessary during that high intensity, high incidence phase of the pandemic. Going forward, what we may see project managers be more concerned about is vaccination status of your vendor staff and whether those staff, depending on local context, need to have full vaccination or at least a single shot may be something that you have to consider. The third point and final point on procurement that I'd like to make is we should plan for increased costs, higher costs for travel domestically for some time, given these complications of scheduling for managing for vendor security and other health security considerations. International travel remains limited And in the short term, costs for international travel, where possible, are also high because of high pricing for airline tickets. So this should be factored into your budgeting and for your short-term procurement. The next short-term issue that I'd like to touch on is employment and employment-related rules. As project managers, many have had to contend with issues related to the health and the security and well-being of staff. And this is from a duty of care perspective. So asking questions of what would expose staff to risk in performing their routine function, their routine tasks. There's, of course, local guidance in each of our DMCs. There is also municipal guidance in addition to national guidance. But I think what we're asking project managers and implementation agencies to do is to ensure there is additional oversight about staff well-being. An important aspect of staff well-being that will be important in this coming phase is about mental health and well-being in terms of how staff have coped with working remotely or working in hybrid situations where some of them come in and some don't. So this is really important to consider. Second, health services are often a very large employer in any community. And I think the way that staff of health services and health-related projects behave and the standard and example they set is going to be very important in the coming phase, especially around vaccination and how well vaccinated they are and what kind of messages they provide around vaccination is very critical. And I encourage us to think about implementation in the short term with these ideas in mind. So I'd like to end with some medium-term thoughts. And as I said, medium-term could be anything from now up to 2 years from now. So obviously there is a large amount of uncertainty around what will actually happen in this period. And the pandemic has shown us that we really cannot take anything for granted. And it has shifted and changed on us so many times. So I will stay at a more higher level. First, I think what we have to understand for project implementation in this coming years is that there will be a lot more emphasis on risk monitoring when it comes to staff health and when it comes to community health where our projects are implemented. So this involves looking at health-related protection, improved infection control, and epidemic early warning systems in our staff sites, as well as at a larger level in the communities, and adaptations and being more nimble and thoughtful about introducing flexibility in how we implement and design projects. Second, and I think my colleagues Stefan and Shotaro will be talking a lot more about this, health is in itself a lot more important to our project implementation and design at a general level. There is a heightened awareness that health may have been neglected in terms of overall country level planning, which is why I think some of our DMCs found themselves in the situation that they were in with perhaps inadequate preparedness. So looking at health holistically and its contribution to our country partnership strategies, the level of budgetary spending on health within ADB and at the national level and in our partners, and using a One Health approach, which means looking at health across domains, both human and zoonotic, human and animal, and I think is going to become a very important aim for ADB and hopefully for you as project implementation agencies. So I think this is a really important implication of the pandemic, and we would do well to heed it. And with that, I turn it back to Najib. I hope my comments have been useful. Thank you.
Oh, thank you very much, Irene. That's very, very useful. We really appreciate your comments, particularly on the effects to the supply chain, cost and procurement, and also highlighting the need to have vaccinated staff and also have some services for employees and also for employers to consider the health services they provide. This is very important. I would like to just move on now to a presentation on, or some, shall we say, some recommendations on, as Aaron mentioned, how can health outcomes be provided to in not just health projects, because if you have a health project, the outcome is clear. But if you have projects from other sectors. And actually most ADB projects are infrastructure projects, transport, energy, as well as other education and social sector projects. So I'd like to go to my presentation, co-benefits to health outcomes from other sectors. So how can you have health outcomes when you're actually doing projects that are outside health? And as Aaron mentioned, health in itself is a good. So how to strengthen results, resilience, and recovery through this method? I had just to mention, and just very quickly, before the COVID-19 pandemic, which we're all talking about, up to 1/3 of deaths in ADB DMCs were linked to environment and lifestyle. Environment means the effects of what's going on around you, for example, through pollutions, but also dirty water, a dirty environment, and road traffic accidents, but also lifestyle. That is heart disease, respiratory disease, and heart disease. Diabetes are always on the top, usually, of causes of death of countries that are going into middle income status. And most of Asia is going into middle income status. So what can you do in this situation? You have a pandemic, but pandemic will likely, hopefully in the next couple of years, we hope, will reduce. But what can you do in terms of a project that has a timeline of 5 years, 7 years, even longer in terms of MFFs? We recommend, or a possibility based on some expert advice, would to have a broad intervention rather than narrow interventions on single diseases or crisis response or very narrow health sector interventions, meaning we should have flexible responses for long-term impact. But these responses for long-term impact should be geared towards vulnerable populations. In terms of ADB, which provides high-quality development, and we're not a private bank, remember, we are a development bank, which means that we want to increase the outcomes for economic growth and lifestyle as well in our countries. We should gear towards vulnerable populations who can least afford it or have less access to health outcomes. And maybe we can use a multi-sectoral approach, which is the topic of our talk today. But what does multi-sectoral approach mean? How can you do a multi-sectoral approach? Political will is very important. Political will meaning because by definition, that means you have to work across several different disciplines and maybe government agencies. You need political will. But not just that, you also need resources. And sometimes the resources have to be shared between different agencies to provide this health outcome in a different project. You need data and evidence. For example, will this multi-sectoral approach, will it work? We're not exactly sure. For example, what is the risk involved in doing this multi-sectoral approach? In terms of quality, what are the co-benefits, or what is how can multi-sectoral approaches be measured? Meaning, if you have a project, you need to be able to measure the multi-sectoral approach, and this is very important. In order to break through this kind of different type of siloed thinking, it is good to have champions, or basically people who are maybe policymakers who are involved in multi-sectoral approaches and believe in their effects. So is it a multi-sectoral approach useful in COVID-19? Aaron actually mentioned that pandemic preparedness is very important, and things such as adherence to international regulations and risk communication is very, very important. But other things related to COVID-19 is air pollution. Air pollution actually increases the risk of COVID-19 sickness. So basically, anything that reduces environment or increases environmental health and reduce pollution is a multi-sectoral approach. Road traffic accidents are actually the cause of 1.3 million deaths. And also, most of the world's fatalities on roads occur in low and middle income countries. As I mentioned, non-communicable disease, that is heart disease, diabetes, hypertension, actually kill 41 million people a year and equivalent to 71% of all deaths. So it's not just COVID-19 we should think about, but also risks to health such as diabetes will increase your chances of dying from COVID-19. If you have heart disease, you have increased chances of dying of COVID-19. So obviously this will help as well. Mental health is very, very important. In fact, mental health has been a identified underfunded issue in terms of COVID-19 responses. So this is very important. And basically, in terms of climate resilient and sustainable infrastructure, for example, in terms of water, sanitation, energy supply, anything that can help climate resilient projects can also affect health. So please consider that health impacts or health are not just pure health projects, but can be integrated. Their outcomes can be integrated in other projects as well. For example, even in environment, building standards for low energy, especially hospitals, because hospitals and health facilities really provide a lot of, require a lot of energy. So if you use these standards and codes, this is going to be very, very good. One of the tools how you can actually see if health has an impact in your project is what we call a health impact assessment. ADB has an excellent book on health impact assessments that we can use. It's basically using to find the economic costs and benefits in investing in health projects. And this has been developed through very good research through the World Health Organization and other development banks. So I recommend looking up this source, as well as another framework we have for health impact assessments in special economic zones in the GMS. This is another specific one geared to GMS projects. So these are available on the ADB website, and we can also provide them to you. I suggest looking at this. Our colleague, Stefan, will be discussing some practical implementations on this on his projects very soon. Health impact assessment, or HIA, is involved in every step of development projects, from planning, implementation, and construction. I think Aaron just mentioned a little bit. You have to take care of the health of your workers. And even before that, you have to plan projects to make sure it does not negatively impact the environment, negatively impact communities, or maybe even produce negative outcomes. In terms of construction, for example, you have to make sure, for example, if there's a risk of sexually transmitted diseases for workers who are working in remote areas, and the possibility of diseases, not just infectious, but also mental health, for example, in remote areas, and also working in high stress environments, like, for example, in COVID-19, and also safety and security. All of these have to be measured and have to be monitored through an HIA tool. So basically, how do you do an HIA? Very, very briefly, I recommend just looking at the presentations of the ADB website as well. You need to screen to see whether it is a valuable thing to do. So this has to be decided by the project, by the client, or by the project implementers. What is the health issue for analysis? This has to be found out. Also, judging potential impacts through an assessment. Actually, our colleague Shotaro-san is going to also discuss some tools that are possible to use in terms of health and assessment. Then you need to combine all of this in a report and an assessment finding. And then once you have this report and when recommendations are done, you need to monitor this. So this is a clear kind of systematic way to make sure that just because you have a health impact, you can also have a measurable result, which is actually the key thing when we're talking about health impacts. Just in terms of details, how would you do a screening? You have checklists, you have expert judgments, and you have national policies on health. So most of our DMCs have national policies on health. In terms of scoping, you can do this through some assistance of consultants, for example, or experts, but also you can do rapid assessments. And there are tools for rapid assessments. Next, in terms of the actual assessments being done in the project, you need to have a comprehensive view. For example, policy, regulation, stakeholder interview. It's always important to talk to your beneficiaries and communities and find out which determinants are going to be affected. and then provide recommendations. This is very important. And once these recommendations are done and maybe put inside the project, these have to be documented, communicated the results, and then have to be monitored, basically for compliance. And this is normally in a health management plan. Again, Stefan will be talking about health management plans in a while. And basically, the benefits of this is you can accurately show that your project is not just, for example, building a road, but can provide very good health outcomes to the community as a whole as well. And this is good for multiple impacts in projects. For example, what are the health effects of infrastructure projects? It could be related to absent workers because they might be ill by COVID-19, but also out-of-pocket expenditures for the contractors. If you have a high cost, as Aaron mentioned previously, this will impact the project. Now, also in terms of, you can measure things in terms of attributable hospital admissions. How many times were workers affected in hospitals? And also, of course, deaths. Deaths have to be measured as well. So basically, this is to conclude these tools. I think ADB aims for high quality development and best practice in healthy project design. And this is where we really try to aim for measuring the impacts of health, which and also doing multi-sectoral approaches, which what we're going to talk about today. So right now, I'm going to stop our presentations, take a pause. Before we go to Shotaro-san, I would like to just request anyone to have any questions for us. And if we don't have questions from the audience, maybe we'll just wait a little bit. I would just like to maybe just pose a couple of questions to Aaron. Aaron, who talked about some of the factors to consider in terms of increased costs, travel, well-being, and the rest. So, Aaron, maybe some of our DMCs will be interested in what are the challenges involved? What are the challenges involved, for example, in increasing the vaccinating status of staff, and for project implementers to increase the health resilience of workers? Any thoughts on this, Aaron? As this might be a concern. Go ahead.
Thank you, Najib, for that question. I think the answer to this is going to vary a little bit across our DMCs because they are at very different stages, as we know, in their vaccination coverage across our Asia Pacific region. So in countries which have a fairly high vaccination coverage, especially for the first dose, where the challenge right now lies, and I think where our project implementing agencies and employers in general certainly have a role, is to encourage their staff who have only received one shot to go back and get their second shot. So right now, where I am in India, second shot completion is a big target and a huge focus, and this will require basically communication with staff, with of course individuals in society in general, that a single shot when you are basically getting a two-shot vaccine is not sufficient for protection, that even if you feel that the number of cases in their community have gone down and hence mistakenly you feel that you have sufficient protection right now, this is an incorrect assumption and potentially risky for society to continue with this. So I think this is an important aspect of some of the issues you have brought up, of how there's a duty of care, how there is a need for communication from employers, because employers speak with authority and have a privileged position when it comes to communication with their staff. But of course, vaccination and second dose completion or even first dose access are issues of the here and now. And what you're asking is also a longer term issue. Like, how should we take the lessons from this COVID-19 pandemic and improve the way employers, project level and at a higher level, major corporations, major ministries, major institutions, what is the change in attitude that should probably happen of how we communicate? And I think there should be a greater realization that employers must have a role in the well-being of their staff, which goes beyond sending occasional emails or letting people know that they should wash their hands, but really thinking about what is happening in the community, whether it's a new pandemic, it's a new epidemic, or whether it's staff well-being in terms of non-communicable diseases, because that is a hidden pandemic that is already in our societies. So I think that is what we should encourage, and hopefully we'll take the lessons from this COVID-19, because there's been a lot of innovation in risk communication, in reaching people through their mobile devices and other ways, and take that forward to the new chapter in our health systems. Over. Thanks.
Oh, no, thank you. Thank you very much, Aaron, for that excellent explanation. So in terms of the health sector, having yourself vaccinated completely with 2 doses of vaccine for COVID-19 is very good. That's the key, one of the key recommendations for resilience. Also, risk communication, communicating with your implementers and your workers on the ground. Thank you very much, Aaron, for bringing this up. Now we'd like to move to some tools, the tools that by which occupational health and safety can be improved. Our expert, Shotaro-san, is now going to give his presentation. Thank you very much. Over to you, Shotaro.
Good morning, good afternoon, and good evening, everybody. My name is Shotaro Sasaki. I'm the Senior Environmental Specialist from Urban and Social Sector Division of East Asia Regional Department. Today, in this presentation of mine, the topic I particularly want to focus is about response to COVID-19 pandemic from health and environmental safeguard point of view. This is the overview of my 10 minutes presentation. I will start from explanation, explaining you how did the impact by COVID-19 pandemic cause changes on our project preparation and implementations from environmental safeguard point of view. Then how we respond to the pandemic. Then I will compare how health and safety has been treated before the pandemic happened, and then what we started after this pandemic in our project level to try to be confident that our workers are safe. Then I want to close my presentation with my conclusion with what I can see from those. Since July 1st of this year, we applied a guidance note on safeguard compliance during the COVID-19 pandemic for project preparation and implementation. I will explain you those with my later slides, since this is not disclosed yet. Basically, this guidance suggests to us possible adjustments such as conduct virtual missions, employ staff consultants to represent ADB staff during public consultations, then complete project COVID-19 risk screening form as part of safeguard categorization, which I'm going to explain you in my next slide. Then encouraging the use of innovative adaptive mechanism for safeguard due diligence and monitoring. Okay, as I mentioned in my previous slide, now we are required to fill up the project COVID-19 risk screening form. And this form asks us those 3 questions. From next slide, I will share you the actual example of our responses to these questions. Okay, the first question, one of our projects in China responded like this: the pandemic will not affect the travel of a national consultant. Then one of our projects in Mongolia responded like this: key sites were visited in 2019 before the pandemic, and new identified potential sites have been examined and visited by the national consultant. For the question number 2, one of our projects in China, again, responded like this: Face-to-face meeting can be organized by the national consultant who can travel to the site. Public consultation can also be supported by information technology, such as questionnaire and interviews through SNS, such as WeChat, which is broadly used in China. Again, one of our projects in Mongolia responded like this. Public consultation were held in 2020 before the pandemic. So question number 3, I mean, this is the final question of the form. Again, you know, I mean, our project in China responded. The national consultant can visit the site and collect baseline data. Remote virtual tour also can be an alternative solution. Another project from Mongolia responded like this. As you noticed, lucky aspect of our project in my division were, you know, we are able to rely on our national consultant since they knew ADB's procedures very well. That's lucky for us. Then also the site visits were done before the pandemic started. And then I will talk about those later again. So how about those projects under implementation? This diagram shows you that we classify our project depending on risks involved. Then in the worst case, when the projects are unable to use standard method or adaptive mechanism, then even we will need to consider postpone implementations. Oh, these pictures apparently show you those good old days before the pandemic, when we are able to have missions, then had face-to-face meetings. I hope that we can come back to those normal life, as I strongly believe that one of ADB's good aspects is to communicate with our clients closely, to understand those real needs and problems of our clients. But now, almost 2 years, we are away from those good old days. Fortunately, actually, those projects under processing as well as implementation by my division, EASS, East Asia department, where I belong, have not been much influenced because we were able to enhance our orthodox method, such as project preparation, started early enough with site investigations. As ADB project usually take enough time to design and prepare. Then utilize national consultants possible as we can, in case they are familiar with ADB procedures very well. Then we also are doing our efforts to apply some new trials, such as remote site observation by using drones, consultations through SNS, request resident mission experts, since we also have a strong team in our resident missions offices who can be on behalf of headquarters staffs. But this can be an extra burden for them. So when this kind of pandemic getting longer, then we need to reconsider this option. At the final part of my presentation, I want to discuss on, so what can we do to achieve for workers' safety? As this picture shows you, during its implementation of our project, in the reality on the ground, apparently those workers might be in difficult situation to implement those precautionary actions, such as maintaining enough physical distancing. So health and safety risks from the pandemic can cause an additional burden on workers, local communities, and the employers. Here with this slide, I'm going to explain you how the current SPS 2009 and Aria Checklist for our categorization treating health and safety. As you know, SPS is our Bible for safeguard actions. Here, environmental policy principle number 10 says, provide workers with safe and healthy working conditions and prevent accidents, injuries, and disease. Moreover, our Aria checklist already have some questions, and we are required to clarify at the project categorization stage about occupational and public health. For example, Aria General form has a question like this: poor sanitation and solid waste disposal in construction camp and work sites, and possible transmission of communicable diseases from workers to local populations. Also, you know, Aria building has questions like this about accident and national hazard. To support our members' country in managing these risks, ADB has prepared the following advisory notes called the Interim Advisory Note, protecting the safety and well-being of workers and communities for COVID-19. I will not go through, in details in it. Instead, I will put the link to this at the final page of my presentation. So please kindly check it later. But all in all, points are, we are starting from what we can do to improve health in our project in this opportunity of pandemic. Here is next slide. Will be showing you an example of what we have started, which is EMP section, COVID-19 project, health and safety plan. I know this slide is, EMP, items are difficult to see on the screen right now. But it's okay. You do not have to go through those one by one now. Those are suggesting you hand hygiene, respiratory hygiene, regular environmental cleaning, and disinfection that are actually guided by the interim advisory note, which I mentioned. And some of them can be done by workers. Then some of them must be done by the project owner and its contractor site. Okay, so this is my final slide to tell you my conclusion of this presentation. Future opportunity to supplement Aria checklists and to strengthen EMPs with lessons learned by this pandemic will be beneficial for workers' health as well as public health in ADB's project areas. When we are adding those new EMP items that were not listed in our current checklist and management plans, this new knowledge will become a positive value. Positive value means, expected to be added by those to prevent not only COVID-19, but other diseases which might happen in the future. Those are the glossaries to the document I mentioned. Thank you for listening.
Thank you very much, Shotaro-san, for an excellent presentation. I think we already have some questions. And I think one question is more directed to you, Shotaro-san. The question is if you could provide a bit more detail on the rapid environmental assessment checklist, because, you actually came up with an excellent list of tools, the risk screening form, and I like the drone survey by drone. I like that. That means, you don't have to be in the field to do a detailed survey. You can do it by drone, and you can do community consultations by Zoom. That's a very good, excellent use of technology. But if you could maybe just explain a little bit more about the rapid environmental assessment checklist, that would be good. And then we have a question on provision of swab testing, that's RT-PCR testing, COVID testing, in Philippine projects and LGUs are normally done by the government, but are there any other sources of funding for testing workers? And maybe this question I will likely go to maybe Arin if you're still around, and maybe Shotaro-san. Is there any possibility that you know of additional funding for testing of RT-PCR for COVID in ADB projects? Thank you. Go ahead.
Okay, Najib. Thank you very much for the question on Aria Checklist. Yes, for some of our listeners now, they might not be so familiar with this Aria Checklist. Aria Checklist, this is used by us to categorize the project. For example, environmental category has, A, B, C. This Aria Checklist is a tool to classify the project at the very beginning of the project preparation stage. So, at the first preparation stage of the project, we usually go to the site. Then, following to our site visit, we prepare this Aria Checklist. Aria Checklist has, several forms, depending on the type of the project, for power plants or transmission or those buildings. So we use different form to fit with each project. And then, we check the items one by one to help the to classify the project. So recently, after this pandemic, we added some questions to check about the screening for this COVID-19. So all in all, this is a tool to specify the risk and then impact of the safeguard. Then we will use this Aria Checklist.
Oh, thank you very much, Shotaro-san. So I believe you mentioned that all of these tools will be available through the meeting organizers and always available on the ADB website. If I can ask maybe Aaron to just come in on your view about the possibility of support for COVID RT-PCR testing, and maybe anyone else, maybe Stefan has some experience in some of his projects where additional funds could be mobilized for the very important testing of workers when they're doing projects. Over to Aaron and then to Stefan. Go ahead, please.
Yeah, thanks, Najib. So at a general level, ADB provided resources last year in 2020 through several emergency projects, including a regional project that provided grant support to diagnostics. But I think these were directly to national governments and to ministries, but not at the project level. You are very right to suggest that each ADB project would potentially have had to either make provisions for such procurement, whether it is to buy the commodities, the swabs, the other consumables, or directly with vendors in the private sector who can then provide these diagnostic services. As far as I'm aware, there is no current ADB-wide financing modality like there is for APVAX, our vaccine financing facility, that is focused on general provision of diagnostics, RT-PCR or otherwise. Maybe turn it over to Stefan if he has views on this. Thanks.
Thank you, Najib and Irene. Okay, I must say that I have a limited view, which is from the perspective of the People's Republic of China, where all my projects currently are located. And due to the specific sort of governance of that country with I think they have a zero cases or zero COVID policy, I think the government would always overrule what we would suggest and try to do on a project level. It's also in the news that China is always very rigid, sort of, and very quick locking down a place if there are cases. So on a project level, we have not done anything because of that.
Many thanks, Stefan. Already some questions are coming in, and this is excellent. Thank you very much for your questions. Really, one of the key issues that seems to come up is really the need to vaccinate workers on the ground in construction projects. So this is key. And as mentioned by Aaron and Stefan, and even through monitoring of vaccinations, as mentioned by Shotaro-san, this can be done in many ways. Basically, there is a question here, and maybe I will direct this to maybe Shotaro-san first. Because it's about measurement. Basically, we have a participant asking any experience or recommendations you have that the healthy, how do we know that health and safety provisions are being implemented on the ground? How does one confirm the high standard of implementation on the ground for health and safety? Maybe over to Shotaro-san. Thank you.
Thank you, Najib. Yeah, I mean, on the ground, I mean, it's very important. I mean, we can I mean, write something on the document, but yeah, I mean, as you pointed out, you know, the on the ground is very important. Then you know, I mean, traditionally, you know, ADB, you know, we are, you know, I mean, take it very seriously. You know, I mean, what's going on the ground. Then, you know, we often have missions. Usually, you know, before pandemic, you know, we are able to, I mean, from headquarters, we ourselves, I mean, including safeguard staff like me, goes to the site and then, you know, see the situation, you know, what's the construction is going on. But, you know, I mean, during this pandemic, you know, as I mentioned in my presentation, you know, while we cannot fly, we need to, you know, I mean, rely on those national consultants and our resident mission staff. Some of them are very well familiar with ADB's procedure, and then luckily, you know, our case are like that. So you know, I mean, they can just go on behalf of us, then check the construction sites, what's going on, how safety is protected. So actually, you know, I mean, the learning experiences, we should have a good training on those national consultants so that, you know, they can be on behalf of us at any time. Over to you, Najib.
Oh, thank you very much, Shotaro-san. So I believe certainly there are many elements involved, but certainly as mentioned by Shotaro-san, I think regular monitoring of all of these health and safety protocols are actually required in ADB review missions after the project is implemented, not just in processing. So it's a clear, you know, due diligence, as we say. Everyone knows about due diligence in ADB. You know, it's not easy to do, but it's very much important for a high quality project. And second, as you mentioned about monitoring, you know, training is of staff to monitor, and training of staff to implement is key. And I think there are some sources or some opportunities for training in environmental safeguards, social safeguards, and others, as mentioned. So just maybe moving on in the interests of time, we have opportunity for questions later on after all our speakers have finished. Up next is Mr. Stefan Rao to talk about his practical experience in providing health outcomes through different ways in different projects, and also how he has practical experience in measuring these health incomes and impacts through his experience. And then after Stefan, we can open it up to questions across the board. So I encourage everyone, please go ahead and keep answering questions. asking questions. Thank you.
Thank you, Najib and Areen and Shotaro for these excellent discussions and presentations. I would like to go into a project level and onto a project level in its whole life. So the question I would like to address here is how we can deliver positive health outcomes through projects. And because I'm an urban planner, I work on urban projects. And of course, most people now in the world live in cities. So this is really most dominant in cities around the world. And of course, also especially in Asia. Najib has also previously shown the health impact assessment and explained the method of health impact assessments. And we have, including also Najib and Susan and some other colleagues, developed sort of a guide to integrate health impact assessment with sort of a step further to help cities prepare healthy and age-friendly action and management plans. So from the departure of a health impact assessment then will be further developed into actual action plans that the cities can implement. When we developed this guide, this publication, in fact, you can see that you can find it. There's a link here on the lower left side. You can download that, and it's also available in Chinese. When we prepared that, we were building on a lot of work from WHO, the World Health Organization, especially in Europe. They've been working on this, on healthy cities since the 1980s. There was a very seminal work, a paper done, published in 1986 by Hancock and Duell, which laid out sort of the principles and also defined what they call here 11 qualities that a healthy city should comprise. And you can see sort of these dimensions. And even though this is already 35 years ago, these principles we think still hold, while the priorities may shift a little bit from these 11 principles. And also depending on where you are, if you are in a developed country or if in a developing or emerging country. The WHO has also worked on age-friendly cities, and the principle here is sort of an active aging, and that should be promoted, and what they call an aging in place, so where people live in the community, in the apartment, close to where they were. They should also be able to be provided with the necessary services, and of course also with upgraded infrastructure and accessibility. The UNICEF has worked on child-friendly cities and some other organizations. So it is also imperative that cities really are designed to be children-friendly. And what we have tried in this publication and also in our method is to link all those three. So healthy cities, child-friendly cities, and elderly-friendly cities, all combined, because these kind of many of the objectives and many of the measures are actually will contribute to all. But if we specifically combine it, we will also create additional benefits. The key the priorities that we feel is important to settle sort of from the beginning. So if you're working in a city, you should start with first things first. So this is why we call this the hierarchy of urban health and well-being. This is based on a very old theory of hierarchy of needs. A psychologist called Maslow did that already in the 1940s. So the first things first. So if you're in a city that has no services and a very poor air quality, very poor water quality, you have to cover that first, obviously. So this is sort of the base of this pyramid, and then you the needs, of course, will go higher as you go up on the pyramid and as you also develop your city. But at the same time, it's important to have all of these in mind, because even if you don't have a proper water supply, you can simultaneously already aim higher for these higher level outcomes in this pyramid. We have developed sort of a step-by-step guides for this HIA, health impact assessment, and then sort of specific steps to prepare healthy and age-friendly city action and management plans. This is all from this publication, and you see here what each step should be done. And of course, a critical part of this step is the step number 1, establish an urban health team, which is interdisciplinary and goes across disciplines, expertise, and also local administrative agencies that work together, and ideally chaired by the mayor or a vice mayor. So you have always high level support and endorsement, the champion, I think that was mentioned earlier. This diagram just is an illustration of sort of how specific health issues are linked to urban dimensions, such as cardiovascular diseases, diabetes, cancer, and so forth. On the right-hand side, the health factors, and on the left-hand side, the environmental and urban factors. So they are quite directly related, and I think that is an important aspect for us to understand that urban environments, if they are good, they can really promote health in a quite direct and active way. This is sort of an example. This is also as part in this publication in the appendix, how urban actions can directly lead to health benefits. So let me just pick out a few here. Of course, you can also read that later on when you access this presentation. So if you have basic affordable water and food supplies within walking distance with better access to fresh, safe, and nutritious food, obviously that's a basic service and a basic health improvement for nutrition, drinking water, and so forth, essential for survival, and so forth. So if we go down, decentralized and high quality health services will also allow people to actively manage their health. Healthy schools, universal accessibility is an important one. I will also mention that later. So people of all ages, so children and old people, can have universally accessible public spaces, public transport, public facilities, and so forth, that will really directly enable a healthier lifestyle for them. And I'll explain that illustrate that with a project in a few minutes. So this is the project I would like to show you. This is also the main case in this guideline that we prepared. So this is a project in the Northeast in China, and we have integrated many things here. And so we're talking here about multi-sector project and health. So when we started the project, the health dimension was not the focus of the project. So we just started with the planning. We did a thorough analysis of what the city's development challenges are, and where they have problems in existing urban areas and also in newly planned urban areas. So more to the east and more to the west on this plan diagram that you see. And then we felt that, okay, the city really needs sort of a public transportation improvement and significant improvement to the urban environment for pedestrians. Bicycles should be promoted and so forth. And then we integrated sort of this transport aspect with green space aspect. More green spaces were also needed to make the city livable. And then we integrated functions in this green space to also serve as flood risk management, what we call sponge city infrastructure. That means if you have a green space, we're designing a green space, it will be probably along a river or a creek. And then when there is a heavy storm event, the green spaces will also retain. So this and then this integration, sort of this how it started. And I think the good thing, what we can say, is that we applied what would be considered international best practice for urban planning. So transit-oriented development, compact city principles, where you have high density, mixed use urban areas around nodes of public transport. And then you make those places pedestrian friendly, bicycle friendly. And then these principles already contribute a lot to positive health outcomes, because you enable people to walk to a public transport station, and also use the bicycle more, so you have more active lifestyles, just through this kind of basic implications. And by developing this healthy and age-friendly city and action management plan tool, we specifically teased out further health outcomes in this project, and we will continue also to do that. And especially the green spaces, they really contribute in multiple ways, both to what I mentioned before, to reducing the flood risk and manage the urban flooding, but also, of course, to a healthier urban environment. Of course, green spaces, they clean up the air, they provide oxygen, they can sequestrate carbon, they can absorb air pollutants and so forth. And of course, they will also serve as a recreational space for the urban residents. And of course, that will also contribute to better health. We have then also specifically, sorry, this is a more technical slide. I can skip over this one. So this is just to show how the flood resilience was improved through integrating this green infrastructure with the gray infrastructure systemically. So what we've done specifically to promote health sort of is a list here. The list is a bit longer, but let me just focus on these. So the BRT line, bus rapid transit, it's the abbreviation for bus rapid transit, where you have an exclusive bus corridor in the middle of a road, and then you have stations well accessed that are optimized. They work more like subways, so you have a bus stop there, then doors open, and then they close in a very efficient way, and then the bus can run very, very quickly on these lanes. So we also remove cars that are currently parked on sidewalks. That's a big problem in the city and in many cities in China, because they make the sidewalk so wide. So we give the sidewalk back to the people, and also add bicycle lanes and pedestrian paths to the BRT stations, that we make all of these safe and based on universal design, meaning people with walking impairments or with wheelchairs and so forth, they can easily access them. And we also specifically have designed safe pathways to and from the BRT stations and schools, kindergartens, and health facilities and elderly care facilities. So we have well-lit public spaces and parks, public plazas with landscaping, and also exercise equipment for people for physical activity, river greenways, sponge city, stormwater retention green space, drainage and wastewater pipes, consultations and public awareness and education campaigns. So involving the community is also something that we have done and will also continue to do during the project implementation. The drainage and wastewater pipes, of course, will also contribute to improved water quality and improved treatment of the wastewater in the city. We have, in fact, what I have not mentioned, we also improved the water supply system, and I think that's also mentioned here. So health, safety related economic benefits, a cumulative value will be more than 6 billion by 2050 through these measures that we are now implementing in this project. And I think that is important to say. And I think Irene and Najib and also Shotaro alluded to this directly or indirectly. It's very important that we quantify as much as we can the benefits from the integration of health, but also sort of the specific health benefits to showcase that we really contribute very specifically to health outcomes. So we have reduced exposure to air pollutants, we have improved water supply safety and security, we have reduced exposure to polluted surface water and stormwater, reduced traffic incidents due to increased traffic safety and traffic management. We have increased physical activity of BRT users who walk, I explained that before, and through the safe and more pleasant pedestrian and bicycle environments, people will also likely use those more. We have reduced risk of extreme cold and heat exposure due to increased green spaces. So green space in a city are temperature buffers, if you wish, in the summer. when the sun, when you have high temperatures and the sun hits an urban area that has no green space, temperatures can be 5 degrees higher in those areas compared to a green space. So if you add parks, you can already relieve the temperature and the extreme heat in summers. And of course, those will be coming more often with the changing climate. In fact, the premature deaths from heat impact is already higher compared to incidences from flooding. We have also improved public awareness of healthy lifestyles through the outreach with the community, and we have strengthened institutions and developed capacity to integrate and specifically bring out urban health planning and then later on management. Here's just a picture to show you a situation. You can see the parked cars currently along the BRT line. So then in the future, you will have a bicycle lane, and then you have a plaza, and then this will be presented to the community in alternatives, and then we'll solicit ideas for how to improve the urban space specifically for people and for pedestrians, and also the dimension of health will be very important in that. I'm sorry if I went over time. Back to you, Najib. Thank you.
Oh, no, thank you very much, Stefan, for actually a quite comprehensive and holistic and almost, a theoretical and intellectual view of how to approach the provision of health outcomes, particularly through urban projects. And urban projects really are, in a sense, quite multi-sectoral. They have many positive outcomes. And I'm happy that you are, promoting health outcomes in urban sector projects through evidence-based methods. So that's excellent, Stefan. Thank you very much. Right now, I'd like to just maybe specifically for Stefan, before we open it up to, sort of key questions. Stefan, you gave a very interesting presentation on, multi-sectoral health, approaches. I think the approach, I'm sure, is, quite interesting and also quite, beneficial. But what are the challenges for developing, designing, and even implementing multi-sectoral projects, in your opinion? For example, if you, as an urban specialist, approach a project as an urban project, this is an urban project, but you want to have health outcomes, what are the challenges you face in terms of getting ownership, implementation, and planning? Over to you, Stefan.
Thank you. So from, I think any city planner would probably always prefer to take a more comprehensive and integrated approach, because it's very clear that if you integrate across disciplines and sectors, local government agencies, you will create synergies and additional benefits. So that's very clear. So land planning, open space planning, infrastructure planning, community design, well-being, and so forth. If you harmonize and optimize those, every dollar you spend will contribute in many ways to positive outcomes, including also to health. And I think this initiative, like your initiative and the health experts initiatives, to bring out these additional outcomes and specifically add value in this dimension, in this obviously universally important dimension, is totally welcome. I think the good news is that, maybe I mentioned that already, the good news is that the good planning principles that are universally almost agreed are also contributing already to positive health outcomes. So I think that's why if we communicate, and maybe that's directly relating to your question, if we communicate very well at the beginning of a project, integration is a benefit. Bringing out health or asking health questions, doing a health impact assessment from the beginning is very, very beneficial, and sort of analyzing a project from the beginning in a multidisciplinary way, bringing in the different local government departments, and then explaining to the leaders what are your challenges. in a multidisciplinary fashion, and then you lay out options for solutions, and then you make them part of your process when you develop sort of the integration of in a project. Then you create the champions yourself. So I think if you engage, if you communicate very well, you communicate what are your challenges, if you communicate the benefit from integrating different sectors and different departments, then I think you can succeed. If you as urban planners, we always say you can only do a good project with a good client, and I think you also can contribute to having a good client through a good communication.
Thank you very much, Stefan. So, if you just allow me, because this is a kind of a session where we can discuss these things, in a very practical sense. In your view, it's more about consensus building around health outcomes for urban planners. I mean, is the answer to providing health outcomes in different projects, non-health sector projects, is it about dialogue? Is it about policy dialogue, in your view?
The beautiful thing about bringing in this health thing is like Shotaro's last slide. Health is a universal public good, and nobody would contest that health is not important, right? So everybody would say health is important, health benefits all. So under the umbrella of health, it's even an opportunity to create a cross-sector coordination and alliances under this, sort of non-negotiable public good idea, where people before probably would not come together. So I think this is a great opportunity to frame the benefits that you create from integrating things in a new way. And I think thanks to the WHO and then all this succeeding work, now many cities are engaged. There's a global network of healthy cities and so forth. So I think it's on the radar screen and also on the agenda of many organizations and also of many cities by now, and I think that's, to me, that's really the beauty. So we can, even I as a planner, I can under the umbrella of health can promote good planning principles. Because and for example, the open spaces, green spaces. I mean, when we go to cities, when we live somewhere, everybody likes a park or a linear green space near to where you live. That also adds value, even monetary value on the land and on the property. And a green space always contribute to many other things. So I think there's also a WHO document that demonstrates and shows sort of the benefit streams of green space in cities for health.
Well, thank you very much, Stefan. And I think drawing on the themes of the workshop of results, resilience, and recovery, I think we all agree that an integrated approach and the methods by which we can measure them, which was very well described by Shotaro-san, and also through other inputs through Arin, really contributes to resilience. If you kind of define resilience as the way to basically recover from a shock, resilient cities, resilient environments, resilient infrastructure, resilient power grids, and even resilient education and health. This is very important. And I think this multi-sector approach and the tools by which we can accomplish this is great. I'd like to just maybe bring it back to some final points from our speakers. And of course, we are encouraging anyone to just ask any questions. We have about 10 minutes left. If I can just maybe request, starting from Arin, and maybe going to Shotaro-san and then Stefan, if you have any final comments, shall we say, key takeaways, key messages you'd like to provide to the, I don't know, many hundred DMC participants and ADB staff joining in the seminar before we end the session at 12 o'clock. So just for final comments, and of course, still open for questions, anyone, please feel free to ask. So Arin, any kind of key takeaways or final comments, for the seminar? Please go ahead.
Yeah, thanks, Najib. Maybe 2 points. One, I think it would be tempting for us to say that as we are now in the 20th, or maybe by some people's count, the 24th month of this pandemic, that we know what is coming and that we have already experienced a lot and hence can predict very well the impact of the pandemic or the continued outbreaks in our countries and on our projects. I think this would be tempting, but perhaps would be premature. I think uncertainty around this pandemic has proven to be high. And one aspect of project implementation we should all embrace, and that really speaks to resilience, is the ability to be flexible and to use evidence and data at the level of our community, at the level of our project, and of course at the level of the DMC to make decisions and to create adaptive management processes at all levels, really empowering decision makers, whether they're at the site level, at the project level, or at the overall implementing agency level, to really listen to evidence and to make decisions on that basis and on that basis alone. And I think this is really a really important aspect of resilience. We don't know yet what the future course of this pandemic in 2022 will look like. Certainly, there's a chance that we will all emerge with a green and resilient recovery, and that the vaccination coverage rates will increase and hence drive down incidents and provide the protection we're all looking for. It is also possible that some DMCs may choose to go for booster vaccinations, and the logistics of that and managing who gets it and when they get it and how that impacts on your staff's availability on site and for project is going to be a little bit of a challenge and certainly something to look out for. Pediatric vaccination is also coming up and it's already started in several of our DMCs. How that affects caregivers, how that affects households, how that affects costs for national governments and budgets are all aspects of this uncertainty too. I think so to reiterate that flexibility and adaptive management is really the call of the day. The second point that I wanted to mention is I guess we are really hearing from many sources that perhaps communication and how we communicate with ourselves as colleagues, and also how we communicate across levels of power hierarchies, has become really an important topic of discussion. And we didn't do so well before the pandemic, and perhaps during the pandemic it was even more strained and harder to do well. And I think improving these communication processes, as ADB, we're learning a lot of lessons of how to communicate across such a diverse and an organization that often spans, 5-6 time zones, how to communicate well in your projects. Please take those lessons from the last year and institutionalize those that have worked well for you, because this is really a health issue as much as it is going to be a project success issue. Over.
Oh, no, many thanks, Aaron, for those excellent points. Shotaro-san, please go ahead.
Thank you, Najib. Yeah, as I mentioned, before the pandemic started, ADB, we already pay good attention to health and safety. So, since this pandemic were not, we didn't know that it happened. So, we were not prepared for this. Then, because of this, now we are learning how to strengthen our tools and also, how to manage the project. I already showed you some example in my presentation, but, apparently those supplement EMP sections, also, the evaluate the project by those questionnaire forms. This will, make our project much better one. Then it will be contributing to the safety of workers. Of course, safety of workers, it's good for them. Also local community, it's good for them. Also good for ADB because, once we have some problem for those safety and health issue, project will be in trouble. So, I think, our efforts now doing will make our project better one. Thank you.
Well, many thanks, Shotaro-san. Over to you, Stefan.
Thank you all. I think as a city planner, we always have a longer term perspective. So short term for us means 5 years, and medium term maybe means 5 to 20 years, and then long term beyond that. So it is also that perspective that I would like to emphasize again, because this session is also a bit broader, not only focusing on the pandemic. So the pandemic will be over whenever it is, right? But cities are there to stay, and investments in urban areas are long-term. Houses, infrastructure will be there, and I think it's very important. In fact, from your slide, Najib, on causes of whatever premature deaths and the 43 million of non-communicable diseases that are related to lifestyles that could be relieved or could be mitigated through healthier lifestyles. I think that would be a big thing in my view. So making cities healthier through proper urban planning, urban design with more green spaces and so forth. I think that's what I would like to offer. Thank you.
Okay, many thanks, everybody.
Communication. I think communication. What Irene also mentioned. I think communicating what is the problem and what we can do to solve the problem in a very broad way and with many people. And in fact, 2 days ago we had a discussion about climate resilience, where so many things happen. We were wondering if it's already 5 after 12 or still 5 before 12. Because we have to act fast. So these things and the evidence that we have from pilots really have to be broadcasted broad and wide so that people understand it and that we can act quicker. And I think the tools that we developed during the pandemic with virtual meetings and so forth, I think that can serve as more platforms. Thank you.
Thank you very much for excellent points. And we have quite common, I think, points across our three panelists: the need for communication, the need for measurement, and the need for practical on-the-ground actions. And I think we have a late-breaking question, actually to Irene, I think, a late-breaking question, or maybe to open it to the other panels as well. We have mentioned future actions that need to be undertaken, but any concrete policies that we could recommend to ensure health and safety of people on the ground employed in ADB projects related to the pandemic situation. So basically, any concrete policies and maybe guidelines. I think I would request Shotaro-san, maybe as the expert in terms of, sort of safeguards and these kind of activities, to maybe just provide a short comment because we're almost done. Thank you. Go ahead.
Yes, Najib. Thank you. As I mentioned in my presentation, we already, ADB already have, safeguard, policy. Has a principle for safe and health. So it's really, we already pay attention for it. But there are some weak points. Then we found it. So we will do our efforts to make the strength, make them strengthen. Thank you.
Excellent. So I think this concludes our panel, everyone. I'd like to thank everybody for participation today in the Health and Safety panel organized by PPFD. Thank you for the opportunity for our ADB colleagues, PPFD, to request us to participate. I bid everyone a good lunchtime, and thank you for your participation and efforts. I think this concludes the panel. So have a nice day, everybody.